teaching health education as well as nurse education, and this channel is Nursing with Koi. Today I bring you the 6th episode of the Midwifery series. Remember, we had stopped at episode 5, so now we're going to episode number 6. This episode is all about the juicy stuff on labor and delivery, and I will go into the details and try to be as concise and precise as possible. If you're new here, please take your time to subscribe and hit the bell icon so that we can continue growing as a channel. And I do love all my family here on YouTube, because we have really been doing the subscribing and hitting the bell icon. So I tend to think we are going to get where we need to go. So without further ado, let's dive right in. Signs of labor include, but are not exclusive to this list, it's just some of them. First, we have persistent lower back pain or abdominal pain with like a premenstrual feeling or cramps, like how you feel before your periods. And this is kind of the feeling that you get when you have that, because the cramps are usually caused by the uterus contracting. But usually they will contract, there will be contractions, and then there will be a relaxation. So there is a small moment of peace, and then the contractions comes back. These painful contractions occur at regular and increasingly shorter intervals and become longer and stronger in intensity as you progress through the labor. Sometimes the onset of labor may be shown or presented by breaking of the waters, or what we call rupture of membranes. So this for some ladies, it is just a big gush of fluid that will come, and you can actually see it on the floor as it falls down. That can happen. For others, it could just still be a tickle or dripping of these amniotic fluids, and you'll just feel it probably dripping on your leg. And then when you go to check, and then you're like, I'm not peeing, it's just fluid that is coming, and you know your membranes have ruptured. So that could be onset of labor. For others, it is the presence of show, and show is bloody mucus or mucus that comes out, where the mucus plug that holds the pregnancy in, that is usually occluding the surface of the surface of the cervix comes off, and you will see it's called the bloody show or the bloody mucus. So these are onset or signs of onset of labor. Aims of managing labor. The aims for every midwife, for every health professional dealing with expecting mothers, is to achieve delivery of a normal healthy child, and to do that with as minimal trauma to the mother as possible, so that we end up with a healthy baby and a healthy mother. And again, it is important to also remember another aim is to treat and recognize abnormal condition before significant hazardous events occurs during the stage of labor and delivery. So it is important to notice this, because most of these things have timelines, and when you have a pathograph, when you're monitoring this mother in labor, there is a number of hours you cannot exceed. I do like how the Ministry of Health has streamlined this, because there are guidelines. For example, if you're in the first stage of labor and it exceeds a certain number of hours, there is the action point. There's a line that is drawn on that pathograph, and action has to be made. Either are we going to augment this labor, and this means you will get drugs to make the pains more intense and more frequent so that the baby can be expelled, or do we need to take this mother to CS, which is cesarean section. So again, remember, it is still normal to give birth to your child through cesarean section, because if your doctors deem it fit, then who are we to say no? And most of the time, and most of the cases right here in Kenya, in most of the public hospitals, you can see most midwives will monitor you, and if there is any sign of danger to you or to your child, you will be prepared for an emergency C-section, because it is better safe than sorry. We do not want, and we must not have a maternal death or a neonatal mortality. So yes, sometimes you will end up on the table even if you began labor normally. begins with onset of true labor contractions and ends with the cervix fully dilated at 10 centimeters with and is the longest stage of labor. It may last from a few hours to a few days. However, in our setting, there are those number of hours in which it may be classified as prolonged labor, and this will be stopped by having a cesarean section. So then second stage again begins with complete dilatation of the cervix and ends up with a baby being born. When the baby is born, we are out of second stage. So the duration should be between 30 and 90 minutes. 30 and 90 minutes. So however, sometimes if it is above 30, it may be classified as prolonged second stage of labor, and this is where the action point is drawn, and you may end up again still on the CS table if your obstetrician or your midwife deems it fit. Then we have the third stage of labor, and this is where we have the separation and expulsion of the placenta and membranes, and this lasts between 5 and 30 minutes. Anything above this will lead to a lot of bleeding, which is called postpartum hemorrhage, and is what we don't want. Sometimes this hemorrhage may come within 48 hours, and that is delayed PPH, and that has its own treatment. And finally, we have the third stage is actually the shortest stage of labor. Finally, we have the fourth stage of labor, and this is after the expansion of the placenta. It's about 2 hours in which the mother is observed to ensure that they do not get PPH or postpartum hemorrhage. And because there is a risk of increased risk for bleeding, they are observed basically to ensure that that does not happen. And this is also the stage where the placenta and those products of conception are inspected to ensure that they are complete and nothing was left inside. So they will expel all the clots, and I know this procedure is quite painful if you've experienced it, because they have to go in and sweep and remove any clots or products of conception that may have remained. In this stage, they also massage the uterus so that they ensure that it is contracting well, and it is also the stage where if suturing will be needed, if they say you've got an episiotomy or a tear, it will be sutured during that, after that stage. Yes. So usually the second stage will take between 40 and 60 minutes since full dilatation for mothers who are experiencing this for the first time or nulliparous, while for multiparous it is between 20 to 30 minutes. However, it may be even shorter. It comes to the third stage of labor. This begins after the baby is born, and it's about delivering the placenta and the products of conception, or the membranes. So this again has 2 stages, and the first one is separation. So there are those signs that your midwife will see or your doctor will see and know that now the separation has occurred. So there is a small gush of blood. You can see the high water coming out and the lengthening of the cord. So there is a technique that is used by midwives or by doctors to deliver this second, or for managing that stage of labor, because this is pretty important to ensure that we do not end up with postpartum hemorrhage, which kills women. So usually it has the 2 stages I've said: separation and then expulsion. It lasts between 5 to 20 minutes, and anything above this has to be actively managed because we do not want PPH. Therefore, in this same stage is when we examine what has been expelled out, or the placenta, the membrane, for completeness, to ensure that no products of conception are left in the uterus after this. So all the clots will be removed, and then we are also going to make a calculation of the estimated blood loss. So it should be between 150 mils to 250 mils. Anything above 250 mils, and this, I mean anything that would be beyond this cap, is too much bleeding, and therefore an action must be taken to ensure that the mother does not end up with anemia, does not end up with PPH. The first initial assessment when a mother presents in labor ward while in labor requires a lot of detailed attention. because the midwife must identify the mechanisms of labor. They must determine the lie, they must determine the presenting part or the presentation, they must determine the attitude, and they must determine the position. Because I said in the cases of malpositioning and malpresentation, when they are not as they should for normal labor, that will be stopped and you will end up with a cesarean section. And it is not because of your own doing, it just happens that your baby is not in the right position for them to be birthed through the vaginal canal. So some presentations are pretty easy to determine by abdominal palpation. Remember, as you attend clinics, there is always the abdominal palpation. This continues throughout the labor, and we have to keep listening to the fetal heart. We have to keep palpating and knowing how far, how is the engagement, how is the descent, what is the presenting part, because sometimes you will be able to tell this. On palpation, it is very easy to say this is breech presentation. On palpation, you will be able to tell where the fetal head is, because as you palpate, you'll be able to feel the fetal parts. So, and sometimes even the abdomen shape will tell you what we are dealing with. So it is so easy to just look at an abdomen and you're like, this is transverse lie, and therefore this is the presenting part will be the back of the abdomen. So yeah, the face presentation and the breech presentation are quite easy to catch on palpation and again on VE, because most of the time, as I have said, you will be able to feel the presenting part as you do the vaginal examination. However, before the active phase of labor, there is no point of doing an examination. We only limit those to a few times. So since you will be there for quite some time, we only do it once every 4 hours and or after the rupture of membranes. So if already your waters are broken, it is important to follow that with a vaginal examination to ensure that there is no cord presenting, or there is no cord around the neck, or you just want to know what is happening around there. Finally, fourth stage of labor. In this time, we are looking at the first 2 hours of delivery, post-delivery, ensuring that there is no uterine atony, there is no excessive bleeding, we do not have postpartum hemorrhage, and if there are any lacerations and lesions that were left behind by the birthing of the baby, or there was an episiotomy given, then this has been sutured and everything has been completed and the lady is comfortable and not bleeding excessively. Remember, lochia is still normal, but there is excessive lochia or bleeding that will signal danger in this period of labor. Thank you so much guys for watching through this video, and I hope this information will help somebody somewhere in labor or expecting to go through labor. And there is nothing wrong with having a cesarean birth if your obstetrician advises it, because sometimes it is just not possible to deliver vaginally spontaneously because of how we have talked about different things that influences, but mostly remember those 4 factors influencing the progress of labor. So if the labor is not progressing, that will not be helpful to keep insisting on doing a vaginal delivery. Actions have to be done. Different actions will be taken, and this will be covered in our next topic, which will be abdominal labor.